Thanks for tuning in to our partner webinar brought to you by the National Association of Nutrition Professionals. This webinar is part of our NANP's partnership program, bringing you the latest information, education, products, and services from the holistic nutrition and wellness space. These webinars are recorded from a live event with a Q&A session for the attending audience. We hope you find this information useful and consider including our partners and their offerings in your life.
Hi, everyone. Welcome to today's NANP webinar featuring the Jane app with Lauren Hetherington. I am your host, Tiffany Perry, Development Specialist for the NANP. These webinars are recorded and can be viewed by registrants via the link that will be sent out later this week. If anyone has any questions during the presentation, please feel free as they come to you to drop them in the Q&A box, and Lauren will answer them as we go along. Okay, let's get started. Today we present From Overwhelmed to Organized, how Jane can help you master admin, communication, and change. Lauren brings a dynamic blend of experience in healthcare, entrepreneurship, and outdoor leadership. Since starting at Jane, she supports clinics and building efficient, patient-centered practices. Before joining Jane, Lauren managed a thriving medical aesthetics clinic that used Jane daily, giving her deep insight into the platform from the inside out. She's also the founder of a kids' bike count, blending business savvy with community impact. Welcome, Lauren. Thank you so much for joining us today.
Thank you, Tiffany, and hello, everybody. Thanks for having me today. I'm thrilled to be chatting with you all about Jane. And I have been a product specialist here at Jane for almost 2 years, as Tiffany mentioned. And during that time, I've had the privilege of working closely with many different disciplines with practitioners, clinic owners, and patients and clients across Jane. Before joining the team, I spent nearly 4 years managing a busy medical clinic that also used Jane. So I've been on both sides of the experience, as a clinic manager and now as somebody supporting you in using Jane to Jane. From my time in clinic, I know how challenging it can be to juggle all the moving parts, keeping up with admin tasks, staying on top of client communication, managing schedules, and somehow still finding time for yourself. It just often feels like there just isn't enough time in the day. And that's why I'm so passionate about helping clinics find ways to use Jane more efficiently, to help lighten your workload, create better systems, and make things feel a little less overwhelming. Over the past couple of years, I've picked up lots of tips and tricks and best practices that can really make a difference in how you manage your time and stay organized. My goal today is to share some of those strategies with you so you can leave not only feeling more confident in using Jane, but also with some practical tools that will give you back a bit of time in your day for your clients, for your team, and most importantly, for yourself. So before we dive in, I want to give you a quick overview of what we'll be covering today. We'll go through a few key areas where Jane can really help simplify your day-to-day, save time, and keep you organized. First, we'll look at how to reduce the workload at your front desk. Now, this may be you if you're the front desk or if you have a team. This will include making the most of Jane's online booking tools, using waitlists to keep your schedule full, and automating things like receipts so you don't have to spend time on repetitive tasks. These small efficiencies can really make a big difference in how your clinic runs and how supported your admin team feels. Next, we'll move into payments, because we all know how important it is to get paid quickly and consistently. We'll explore how to set up prepayment policies, streamline invoicing and receipts, and make use of balance reminders, so clients are nudged automatically rather than you needing to follow up manually. These tools are designed to help improve cash flow and reduce awkward money conversations, which none of us love to have. And then we'll talk about communication. I'll walk you through Jane's secure messaging, how you can customize reminder and notifications, and how to set up clear notices and messages in your online bookings so clients always have the information they need upfront. Clear communication saves time, reduces no-shows, and helps build trust with your clients. And we'll look at one of our newest tools, AI Scribe. This feature will literally save you hours by helping you with charting, turning your notes into clear, professional documentation in no time at all. I'll show you how it works and share some best practices so you can get the most out of it. And finally, we'll wrap up with a Q&A session. So if you have any questions along the way, feel free to add them into the chat, and we'll make sure that if we don't address them during the presentation, that they're addressed at the end. Alrighty, so let's jump into our demo of Jane. So this is Jane. So if you haven't seen it before, we have the option to offer your clients online booking through this beautiful online booking page. Now, this can be completely customized to your clients and to your branding. So you'll have the option to change your colors here, add a logo, and pop in an online background. You'll see in our clinic here, we have 2 locations, and we have many practitioners working at these locations. All of these practitioners are different disciplines. So we have Michael, who will be our naturopath today. We have a chiro, we have a physio, we have a counselor, we have a Pilates instructor, and we even have an acupuncturist. So Jane not only works well for a solo practitioner just working as a nutritionist, but also multidisciplinary. To book an appointment, you can simply click on the staff member and it will bring it up here. And then we have a couple of different options. So we have a new patient visit and a return visit. You set your prices, you set your times, and you can also include any important information you want to share with your clients. When I click on one of the different appointments, it populates the calendar here and it jumps to our first available appointment. I simply click on the time and you'll see here I can book more. I can say don't book that, and I can choose a different time. To book the appointment, I simply hit continue, and now it's bringing me to a payment scheme. With Jane's integrated payments, we can collect a credit card at the time of booking, which will help prevent with no-shows, late cancellations, and can also be used later to charge the card on file. I simply pop my credit card in, add in my zip code, and this is saving the card. And you'll notice here, it's also letting the clients know that it won't be charged at this time.
Lauren, we do have a question.
Please, yes.
How can you help if someone is coming from another software?
Yeah, absolutely. So if somebody's coming from another software or maybe like another payment processor, what we can actually do is we can do a credit card rate comparison for those people. So if they think that they're getting a better payment rate with their current credit card processor, what we'll actually do is we'll get 3 months worth of statements and we'll compare the rate, because a lot of the credit card processors have a lot of hidden fees that are built into them. So they might charge a monthly transaction fee. They might charge an annual fee. They might charge a fee for renting the terminal. They might charge a fee if it's over a certain amount of transactions. With Jane Payments, everything is built in. So the fee that you pay per transaction is the only fee you're paying. I'm going to jump into that in a couple of slides. I have our fees written out, but we can definitely work with people if they're locked into a different payment processor or like software with that. But great question, Tiffany. Thanks for asking that.
Thank you.
So once we save the card on file, that credit card is now saved to be charged at a later date and the appointment's booked. So super simple, nice and easy. When I show this to people, always say, is that it? Is it that easy? And we want to make it easy for your clients to find you, book an appointment, and have everything done in one place. They can also pop a reason for their visit in here, and that will pop up internally, and I'll show you where that is. They can fill out their intake form online. So no more emailing, no more paper. It's all taken care of automatically through Jane, and they can subscribe their appointment to their calendar. Whether you choose to have online booking for your clients or not, everybody has access to what we call our client portal. In our client portal here, again, you'll see credit card on file is expiring, and they can update that. They're prompted to complete the intake form if it's not yet been completed, a list of their upcoming appointments, and waitlist requests. So if you run a very busy, bustling practice and you're constantly asking, say, or hearing people say, I tried to book in to see you, but I can't see you for a month. But you also know that maybe you're going to have people that need to reschedule or cancel because, hey, life happens. People can add themselves to your wait list. So they can request their location and we'll book with Michael. And they'd like to come any day this week, anytime. They can add themselves to the wait list. And when we jump into the back end of Jane, I'll show you where those waitlist requests come up. Again, another way to free up phone calls, emails, time at the front desk. They can also see a appointment history. So again, if they think, oh, gosh, when was the last time I had my appointment? I need to really get back in. They're able to see that there. One of our new features here is our messaging. So you're able to directly message your clients, maybe a follow-up after an appointment, just to check in on how they're doing. See how they're going with that food diary that you asked them to start. Seeing how they're feeling after you've recommended some supplements. That can all be maintained through Jane. And later on in the presentation, I'm actually going to show you something really new and exciting that we have coming to the US, hopefully by the end of this month, which is our Jane mobile client or patient app. And there will be the ability to directly message your clients to the app. You've got your intake forms that need to be completed, and they'll also show when they have been completed, and the documents section. So this documents section is a great way that you can share files with your client that you need them to print out and complete. So here I have a food diary that I've attached. You can also share images of recipes, meal planning. You can share short audio and video files. You can share some chart notes. You can share referrals, anything that you don't have to send over email. And everything here is HIPAA and PIPA compliant. As we noted before, we've got that credit card on file that needs updating. We also have our pay balances. So if they have an amount outstanding, they can pay the balance on their account with one click of a button. And then receipts. So when it comes to tax time, again, that load on the front desk of I need all of my receipts for the whole year so I can submit them for my taxes or submit to my health spending account. They're all here for the clients to access themselves, freeing up time for you in the front desk.
Lauren, I have a question.
Please.
Does Jane connect with accounting platforms for streamlined bookkeeping like books?
Great question. So while we don't currently have an integration for any accounting software, all of our reports are exportable to Excel and work really well with QuickBooks. We are looking currently at an integration with some accounting software. We currently have beta testing available for payroll. So having staff log in and out, and we're just in the last couple of weeks rolled out payroll along with that, so that you're able to pay your staff directly in Jane. So while it's a not yet, it will be coming down the line very soon.
Thank you.
Pleasure. And that is it with the patient-facing side of things. Anybody have any questions? How's everybody feeling about it? It's designed to be simple. It's designed to be very user-friendly. Later on in the presentation, as I said, a lot of this can be managed through a patient-client app. So folks will be able to download the app from the App Store and book an appointment, reschedule an appointment online. So I'll take you on a bit of a tour of that later. But if there's no questions, Tiffany, we'll jump into the admin side of things.
I do have one quick question here that was sent to me. Let's see here. Are there tools for recurring services?
Yes, absolutely. So that's taken care of on the internal side of Jane. So let's jump into the back end. And this is the schedule for today. So again, if you work in a multidisciplinary practice, you'll see everybody that's set out to work today. We'll look at Michael's schedule. And this is Michael's schedule for the day, for the week, nice and busy. And you'll see here, first thing we can see is that appointment that we booked. So you'll see those notes that I added for the appointment in here. We can see it's a first visit. We can see it was booked online. And if we click in here, we can see a little bit more information here about the client. Now, to answer that question, if this client decides that they'd like to book to see Michael every Wednesday till the end of the year, we can very easily schedule that with one click of a button here. So we can say that we'd like to see Michael every Wednesday until the end of December every week. Now, not only will Jane show you when the appointments are available, it will also show you if there's any conflicts and offer an alternate time. So we can select them, come through. It will also show you if you're not available, say if you're off for the day, if you have a break in that schedule, and then you can very easily with one click book all of those appointments. Life happens if the client says, actually, I'm leaving, I'm moving, I can't do these appointments. Very simple to go ahead and delete all of those appointments.
And somebody did drop in the Q&A box. They said, could you repeat, does Jane have accounting software included in the program?
Great question. So we don't have accounting software per se that would link to QuickBooks. However, we do have our reports area here. So our reports area here has all of the reports you would need to reconcile your statements, provide to your accountant for tax time. We have an accounts receivables report. We have a sales report, which will show you daily sales. We have a summary report, which will show everything broken out for taxes. We have that breakdown here. We have a transactions report. So this will show you all of the different payments you've taken, broken down into cash, credit card, check, so on. If you do go with Jane Payments, we also have our Jane Payments reports here, which will show you the amount charged to the credit card, the fee taken by the payment processor, who is Stripe, and then what will be paid out to you.
Okay, yeah, they said they were trying to cancel QuickBooks.
Yeah, so a lot of these reports, as you can see here, when we hit here, we can export it to an Excel document. The summary report generally is the report that most people need for the end of financial year for the accountant, because it will show the breakdown of the different income categories. It'll show the different sources. If you've got the taxes to pay, it will show all of that, refunds. Your accounts receivable shows amount outstanding to you. I know a lot of people that just give these reports to their bookkeeper or run them at the end of the year, and they don't need QuickBooks for that.
Thank you so much.
Pleasure. Thank you. Thank you for the questions. Keep them coming, please. So if we pop back into the schedule here, you'll see I deleted that appointment. It's really easy to make an appointment with Jane. Internally, you just click on an open space, select the treatment that you need, add the patient in, and book that appointment. The mechanism for generating payment, taking payment, we arrive the appointment, and you'll now see that there's an amount outstanding here. To take payment, it's as simple as hitting pay, clicking next. Now, you'll remember we entered a credit card for this client. We can click here, and when we hit pay, this will not only charge the card on file, but it will automatically send a receipt to the client. The receipt looks like this. So it will have your clinic information, your logo, the client's information, the date, time, duration, and type of appointment, your information, your credentials, and most importantly, your licensing information here. If your client needs to generate a receipt for tax, HSA purposes, that information should be sufficient for that. We are also able to generate super bills. I know from speaking with Tiffany that a lot of your services are not available for insurance purposes. But if you did have a client that was able to submit for insurance, we can generate a super bill very easily here as well. Booking another appointment is as simple as copying, and then we can paste it over here We can also drag and drop and notify the client. We can move it anywhere here. If we don't want to notify the client, we can make appointments longer if we need to. And this calendar can be connected to your Google, iCal, or Outlook calendar so that all of your Jane appointments show up in those personal calendars for you as well. That's pretty much Booking 101, Admin 101. A couple of other features I would like to highlight. That waitlist request. So you'll remember when we're on the client-facing side, we added a waitlist. Those waitlist requests show up here. With our Thrive plan, we have a feature called automatic waitlist notifications. Our Thrive plan is our highest plan, which I'll discuss at the end here. But with that, if somebody cancels an appointment, Jane will automatically send a notification to the first client on the list that fits the parameters, notifying them that an appointment has become available and inviting them to book that appointment, thus filling that blank space for you. On our practice plan, you're able to simply see the wait list, click here, book that appointment, select an empty time, and remove the client from the wait list.
Lauren, I have a question. How responsive is customer support? Is there live help during peak clinic hours?
Great question. Absolutely. So all of our support is human, helpful, and kind. We have customer support workers that work both in the Canadian and US side. It's all humans. So while we do have support available via an AI chatbot, if you choose to chat with us, you'll be connected directly to a person. We can chat with the Jane team, chat here, and within minutes, you're going to be connected to somebody on the Jane team. We can pop our question in, and then me or somebody like me will be at the end of the chat able to chat with you. Our call times, our average call wait is about 5 minutes, and we work from 9 a.m. EST to 5 p.m. PST, Monday to Friday. And we also have phone support available on Saturdays from 8 to 12 PST. So we cover a pretty wide range. We're also always available by email, and we don't hide our support like a lot of other softwares do. So if you need a call, you just click call Jane, or you can send an email. So I would say that's one of the key selling features of Jane is how incredible our support is, how available it is. We also have, as I was saying before, we have our AI. So our AI sidekick can also help with our questions. So if you pop a question in here, our AI will search through all of our guides, all of our resources, and give us an answer within here as well. Great question. Thanks, Tiffany. Oh, there's Andrea. So we can say, hi, Andrea. I mean, our chat got picked up in 2 minutes. So that's pretty good, I would say, for a chat. I'm going to just let her know it's me, and she can go ahead and close the chat. All righty. So we'll close that chat. Perfect. All right. One of the other things I did want to focus on the admin side before we jump into our charting and using our AI scribe is the reports that we have. So we looked at a few of the billing reports. We also have a couple of great reports, again, that will help with your admin load. So we have our unscheduled patients report. So this will show you anybody that hasn't booked an appointment since the last time they came in. You can run that for a date range. We also have return visit reminders. So if somebody cancels an appointment, so we'll go here, that appointment gets canceled, you'll see there's an option to add a return visit reminder. So you can say, let's say this person should come back in 4 weeks. It'll give a suggested date. It will give a date that the reminder will be sent. You can add a message. Now, in the next 4 weeks, if the client doesn't book an appointment, on the 24th of September, it will send them a return visit reminder. If they do book an appointment within that time, it will cancel that reminder. But that's a really neat way to help with your client retention for sure. Any other questions on this before I jump into our charting, Tiffany?
I do have a question, just
Great.
because I'm curious. Does Jane offer tools to support marketing? Like if somebody wants to do their own type of promotion or referrals, campaigns, anything like that. And this may not be the right place to talk about it, but I just wanted to see if you could touch on that at some point.
Absolutely. Such a great question. So, again, as part of our Thrive plan, we're really looking at ways to help clinics with their marketing, with client retention, with building their practices. So, we have a couple of great features. So, we have an integration with Google Analytics so that you're able to track your clicks and see where your clients and your referrals are coming from. We also have the option to set up ratings and reviews. So, at the end of an appointment, you're able to send out an email to your clients based on every visit, every 7th visit, so on and so forth. And you can ask them for a review. If they give you a 4 or 5-star review, they will be asked to leave a review on Google for you. Now, this is a Google thing. We can't directly link the rating to your Google reviews. That's a Google setting that they've been very strict about. If they leave a 1, 2, or a 3, they'll be asked to give you a little bit more feedback on why they left you a lower rating, and that won't link to the Google review. So that's one way that we can get reviews. In terms of marketing emails, things like that, clients are asked when they create their account whether they accept being sent marketing emails. If they consent to that, we have an integration with MailChimp, and you're able to export that client list that has consented to marketing emails and send any of those marketing emails outside of Jane in MailChimp. Now, that being said, because we are dealing with personal health information, we need to be HIPAA and PIPA compliant. Jane is really mindful about who we integrate with. A lot of softwares have an open API, and that really leaves you open to data breaches. So currently we don't have an open API, but we are looking at having an open API for select partners that we will partner with. So Google being one, MailChimp, we're currently looking at a CRM, so client retention management software, and there'll be the ability then for mass text messaging, mass emailing directly within Jane. But we're just taking that slowly bit by bit, just as we build our partnerships. Later on in the presentation, again, I talk about our partnership that we have with FullScript. So we have an API with them so that you're able to take that information from Jane and populate it into FullScript. So again, a more broader marketing partnership is on the cards, but just not available yet. Does that answer your question there, Tiffany?
Yes, that's great. Thank you.
My pleasure. You're welcome. Alrighty, so let's jump into charting, probably one of my favorite parts of Jane. So what I'm going to do here is I'm going to sign in as our practitioner. And this is our demo clinic. So at the end of the presentation, I'm going to strongly suggest that everybody sign up for a demo of Jane so we can really do a tailored demo to your specific needs. This is a very broad general overview, but we offer one-on-one demos with folks interested in signing up for Jane. But you'll also have access to this demo clinic. So you can come in, you can play around. And one of the big features of Jane that I would strongly recommend trialing is our new AI scribe. So what that means, I'm sure you've all heard of it. It's the latest kind of buzz thing taking over all of the different industries, is for AI to listen to your appointments, record your appointments, and then at the end of the appointments, generate chart notes based on the recording and the prompts that you give it. So we have it enabled in all of our demo clinics here. So you can come in, you can upload a recording, you could record a test appointment with a staff member, and then see the output that the AI gives you. If AI is not for you, and it's totally fine, it's not for everyone, we also have a great range of templates, prompts, things we can have built in Jane to help make your charting easier, because I know for practitioners, a lot of the time spent is on charting.
And I do have a question about charting. Is
The-
there voice to text or dictation capability built into charting?
There sure is. Great question, Tiffany, and thank you
Oh,
for answering that one.
that's
So
good.
let's go over the kind of the regular way of charting, and then we'll take some time to look at our AI scribe. So this is what the practitioners see when they log in. So you'll see here there's a dashboard. You can choose to have the dashboard disabled for staff. You can choose to remove all of the financials. But as clinic owners, this could be really important to you. So it's showing you some important metrics, top patients, total visits. You can filter it by busiest months of the year if you're planning for holidays, busiest days of the week. You've got your top treatments, how many chart entries have been done, and your top clients here. For charting purposes, we always say that we like to chart from the day view. So when we're charting from the day view, this is your list of clients for the day. Now you'll notice our demo owner is a different color now. They're green because they've paid for that appointment. So again, a super quick, easy way for you to look at your schedule, see who's paid, see who hasn't. When we go to chart, we simply click on the appointment and then the chart pops open here. Now, you'll remember from my earlier example, we had that food diary. So sharing documents with your clients is as simple as a drag and drop. And then we can make this visible to the client and let them know. And then to start a chart entry, we have a few different chart pieces here. So we have notes, we have vitals, we have that file image that we can drag in, we have a primary complaint. We'll look at later this smart soap note, but we also here have what we call our chart templates. So in Jane, we have a chart template library that's hovering around 100,000 chart templates. These templates have been designed by other nutritionists that have gone to all the work of building all of the parts of the chart and then out of the kindness of their heart have shared them with the community. So I always say, why do all the work if somebody's done it for you? So you can go through and have a look at the different templates, see what works for you. You're always able to edit them. And then everything's built in here for you. So you'll see here you've got check boxes, you've got sliding scales, you have drop downs. These are note boxes. You also have a body chart if you'd like to add in an image of a body. So you can add in that. Now, working through it, Tiffany's first question, dictation, voice to chart. You can absolutely dictate your chart notes. So in any text box, you turn on your dictation and it would put in your findings here. We also have phrases. So if there's things that you write over and over again, you've got little shortcuts here for those. We also have a few shortcut keys here as well. So little symbols that you can use. Within here as well, as I come down to that body chart again, within the body chart, you have the pointer tool, which you can then write your findings in here. You've got a drawing tool, so you can draw on the body chart. And then when you sign it, you're also able to pin parts of the chart. So if I come down here, I'm able to pin this sliding scale. This will now sit at the top of the chart and will show an overall symptom of that 50. So a quick glance if you want to keep track of your client's symptoms, how they're feeling, that can all be done there. You can also search the chart. So if you're thinking about a meal plan and you think, I have a feeling they don't like ginger, you can type ginger in here and it will show you any charts that have the word ginger in them. We also have the medical alert here. So you can keep track of any supplements, medications, any illnesses, things like that. And you can save those in here. That's available for everybody to see. You also have the option to create treatment plans. So within that treatment plan, you can say, I'm going to create this treatment plan for the next 12 visits. And then within the treatment plan here, you'll be able to group all of your charts together for that specific treatment plan. Any questions popping up in the chat there, Tiffany?
The question is, what does onboarding look like? Like, how long does it take for a clinic to go live using Jane?
Yeah, great question. So we recommend 2 weeks. Something that Tiffany, you mentioned about support with importing a bit earlier. We can help support with that. We have account setup calls available. So it would be very similar to what we're doing now. Myself and yourself or a representative from the clinic would meet in a Zoom and we would walk through helping you set up your account. We do have this inbuilt setup wizard that walks you through everything as well. You have the ability to chat or call in with our staff. But we say 2 weeks to get everything up and running, get all of your information from your previous software, get your clients in. Depending on the software, we're able to bring in clients, we're able to bring in past and future appointments, we're able to bring in charting information. The only thing we can't bring in is billing, just due to the complexities of the different billing software and framework that different softwares use. So that would have to be manually brought over if you had outstandings or you had credits, but we do have ways of working with that. If you have complicated schedules, so you see 2 people at once sometimes, you see people on a stagger, you work out of multiple rooms, you have multiple staff members, you only offer certain treatments on certain days. We help with building all of that advanced scheduling. We help with your intake forms. We help with set up every step of the way. Great question.
Thank you.
My pleasure. So yeah, last thing before we jump into our AI charting is going to be that chart template that I discussed. So I'm going to show you the template library and then we're going to build a template for our AI together. So underneath the staff profiles, you'll see we've got templates and then here's that template library. So you'll see here all of the different disciplines it's separated into. So if we look at dietetics, you've got here 638 templates, so you can search from within there. So Tiffany, would there be an important thing for the folks that I could search here?
My eye went straight to the top holistic nutrition intake form.
Perfect. So this one as well, we can use these templates when we build the intake forms that the clients are going to fill out. So Alyssa here has done all the hard work of building this template for us. Thank you, Alyssa. So we can go through, we can say, yeah, you know what, that works for me. So we can add it into the library and then we can go ahead and we can edit it. So we can actually say, you know what, I don't need that. So I'm going to delete that. And I'm going to change this. And I'm going to save that. So all of this is editable. But as you can imagine, having to not go in and create all of this because Alyssa's done the work for us is going to save a lot of time. Now, a big question I often get is, can you bring in intake forms from previous software? We don't have the ability to import those forms, so you will need to recreate everything in Jane. But hopefully you're seeing how simple it is to recreate those forms within Jane. And again, the time that you may be taking right now to send someone an email, get the response, it populates in a Google form, then you need to go in and read it. When the clients fill out this intake form, the response to all of these questionnaires goes straight into their charting area for you to read and see the answers for. Let's jump into AI Scribe. So AI Scribe is an add-on. It's $15 a month per practitioner, and it's completely optional. So you may have some folks in your clinic that want to use it and some that don't, so you just opted in per practitioner. Once you're opted into AI Scribe, the most important thing to remember are the prompts. Now, I always say with the prompts, if you think it or say it, write it. So if you're familiar with using AI, ChatGPT, things like that, you want to be as directional as you can. You have to think of the AI as your charting assistant. So if it's missing something, you need to tell it to add it in. If it's doing it wrong, you need to refine the instruction. My favorite story I love to tell is I had a practitioner email saying, love AI Scribe, love everything about it, saving me hours and hours of work. It's incredible, but it keeps spelling everything in American English and I'm in Canada. And we use U's and we don't use Z's, we use S's, and it's driving me bananas. Can you fix it? And I thought, and I suddenly said to her, why don't we just tell it at the end of the prompt and spell everything in Canadian English? And she did it and she tried it and it worked perfectly. So if you always keep that in the back of your mind when you're generating this prompt, it's really going to help you with your charting. So to create what we call these prompts, they're done under the template. So in the template library, in the template area here, we have our Smart Soap Note. Within here, this is the prompt that we have created. It's a pretty general prompt. It's for all disciplines, behavioral health, nutritionist, chiro. So it's a very generalized prompt. So you'd want to make it more specific to what you need out of that output. You can have it in point form or narrative. And once you've created it, you'll hit save. I have one I've done earlier here. So what I'm going to do now is I'm going to come in and I'm going to start my soap note. Now, Tiffany, going back to the before about the dictating of the notes, you can use AI Scribe to either record your sessions. If your clients aren't comfortable with that, you can also use AI Scribe to dictate your recollection of the appointment and request that the AI Scribe generate a chart note based on that.
Okay.
So it's really helpful for both. What we're finding, we definitely recommend reaching out to your governing body about getting a consent for the use of recording and using AI because everybody's governing bodies are different. It's even by state. But what we're finding with feedback from our ambassadors and practitioners that have been using AI Scribe is it's all about how you deliver this to your client. A big thing to highlight to your clients is using AI Scribe allows me to be fully present in our appointment today. It allows me to not miss things that are said. It allows me to focus 100% on you. And it allows me to ensure that everything is captured and it's an accurate reflection of what is captured and not just my recollection. People can still choose to not use it. That's fine. Then you can use it to dictate your recollection. And you can also choose how long the recordings are stored for. So you can choose that the recordings are deleted immediately after the prompt is generated, kept for 7 days, or kept indefinitely. We do not use our AI Scribe to train any language learning models, which is a big one. And we're constantly using different AI as well. So we're really keeping up to date on the different trends. So we're constantly innovating and learning and adapting as we go. So to start the AI, you can start recording the audio here. When you're recording the audio, you can leave the page if you need to show them something, look up something on Google, and you can come back and it will continue recording. When you're done, you hit end recording. I'm going to upload a file that I got earlier. So I've got this one here, and we'll see here how long it takes to process the audio. So what the AI is doing now is it's listening to the audio. It's thinking back to the prompts that we've given it, and it's then going to generate a chart note for us based on the prompts. So again, if something's missing, if something's not right, if you're not liking it, then we go back to the prompt and we change the prompt. So you'll see here how long that took just then. You also have the option within here of viewing a transcript of the appointment as well. So this can also be helpful just to make sure you haven't forgotten anything. And then you'll see here we have a basic soap based on this recording here with a plan and with recommendations. Now, as I mentioned earlier, we have an integration with FullScript. So any supplements that you would like to recommend to your clients, you can integrate with FullScript for that. And we can also say that was good or it needs work. pretty cool, pretty exciting. It's constantly adapting. The next feature we'll be using it for online appointments. I know this discipline could use online appointments a lot. We're not recommending it for online appointments or virtual appointments right now, just due to the quality of the recording, but it's something that it's at the top of the team's focus. So we will probably have it out within the next few weeks. That being said, people are using it during online and virtual appointments, but just being aware that the recording quality may not be as great as what it is when you're in person with a well-functioning microphone. What do you think, Tiffany?
I think that's fantastic. I wish I would have had this in college to take notes for me.
I know. Oh gosh, it's such a time saver. And they always say AI isn't going to take your job, but somebody using AI will. So
Yeah.
if we put that into time saving, while you're still there writing your notes at 7 o'clock at night, your colleague that's using AI, they were out of the office at 4 and shopping at Target and cooking a nice dinner and enjoying some extra time on the couch watching Housewives.
If someone was going to ask, why should I choose Jane? I'm guessing this would be one of the larger features.
Yes, that's such a great question. I think when people ask why Jane, you hit the nail on the head before when you asked about support. We have fantastic support. We're always only a phone call away. We're helpful, we're human, we're delightful. We work with different practitioners from different disciplines. A lot of us have worked in clinic. We're here because we want to help people. Second of all, we listen to our clinic's feedback. So many clinics were reaching out saying, hey, what can we do with AI? So we're really at the forefront of developing features that our clinics want, that our patients and clients are telling the clinics. So we really take on that feedback, and we work well for so many different disciplines, and it's easy for everybody to use. So this is a huge part of not just the AI, because a lot of different softwares have AI, but the fact that we take the feedback on. We do beta testing and people say, hey, this is great, but could it do this? Could we have this? And we're really responsive to that.
Thank you.
Yeah. So that's Jane. That's a demo of Jane. I do have, as I mentioned, a couple of different other features I want to highlight in the last few minutes here. Payments. We discussed payments. So we've gone through no-shows, we've gone through cancellations. That's covered with the collection of the credit card on file. Books. You don't need QuickBooks because all of your billing, all of your reporting is contained within Jane. Easy for you to see when you're getting paid out, how much you're getting paid out, how much tax you paid, how much you paid with fees. Another important one is collecting outstanding balances with one click. So if somebody owes you money, you can send them a pay balance reminder and they can pay via their credit card, Apple Pay, Google Pay, and that's done with one click of a button as well. So Jane Payments, fully integrated payment processing.
And you said you offer super bills, is that correct?
Yes, we do offer super bills, correct. So we had mentioned before that unfortunately the nutritionists are not generally covered by insurance, but if somebody does need super bills, they're included on our practice and our Thrive plans.
Thank you.
Thank you. And then some upcoming features. So I know I spoke a lot about messaging and our client app at the start. I wanted to give you guys a tour of it and show you what it looks like. So I hopefully want to make sure that I shared my sound. So Tiffany, please let me know if you can hear this once I get this up and going here.
With the Jane patient or
I can hear
client,
it.
they're available in the US Apple and Google Play stores by the end of September 2025. Your clients are able to store all of their appointments from any Jane clinics they use in one place. There'll be a central login to log into the app. They can choose to unlock the app with Face ID, and then all of their upcoming appointments will be stored. You'll see here, I have 2 upcoming appointments. I can go through and I can reschedule the appointment, and it links directly to your calendar to offer alternative times. You can choose any times up until the future that match your online rolling availability. You can cancel the appointment, and clients can also read your cancellation policy here. To book an appointment, all of the Jane clinics your clients visit will be stored up above. They can select the practitioner, select the appointment, and it will default to the first available, or they can choose an appointment that suits them. They can book for themselves or a family member that is attached with our relationships. And that appointment is all booked in. They can put a reason for their visit and they can add it to their calendar. Currently available in our Canadian stores, you can also add any clinic very easily. And for the purposes of this, you'll see here, it will show you when they're last signed in. And you can add that account. And in our Canadian clinics, you are now able to message your clients directly through the app. When you message the client, it will send them an email notification, and it will also show up here in the messages tab at the bottom. And then they will be able to reply directly within the app to any message you send them, very similar to what we saw in on demo earlier. Future iterations of this app will include a push notification for messages. So when you send them a message, they'll get a notification on their phone and they'll be able to go straight into the message and reply.
Exciting things. We also have a two-way sync with Google. So I mentioned how you can sync your Jane calendar to your personal calendar, and we're in beta testing right now to bring your personal calendar into Jane. So if you just look at Jane as your one calendar, all of your family, personal appointments will be in there. And I did mention we have that integration with FullScripts. FullScripts was Rupa Health was recently acquired by FullScripts. So we do have eLab and ePrescribed coming as well with the FullScript integration. We talked about support. We talked about why Jane. We believe great software should always be backed by great people. And that is what we provide you, is great support every step of the way, building trust and guiding you through any questions you have, any help that you need with import support, onboarding and training, and just anytime you have a question, giving us a call. Our goal is to make support not just helpful, but delightful, so every clinic feels cared for and confident at every stage of their Jane journey. Pricing, I briefly chatted about. We have a limited time offer, so it will be expiring on September 8th. Our balance plan, perfect for a solo practitioner seeing less than 20 appointments a month and not interested in online bookings. So $39 a month. If you sign up before September 8th, you keep that price until you're ready to upgrade to one of our other plans. We have our practice plan, which is $79 a month. That includes online booking and no appointment caps. And then our Thrive plan. So that plan, Tiffany, was the one that really works with the building the practice, the marketing, the referrals, the reviews, the advanced scheduling. We do have a code. Tiffany, I'm sure, will include this elsewhere. And if anybody needs it, please feel free to reach out to us.
Yes, make sure to screenshot this, and it will also be sent out with the web link, the recording.
Perfect. Yes. So that will give you a 1 month grace period on any of those 3 plans that you sign up for. And then we have our Jane community. So we have a Facebook group. We just hit 20,000 on our Facebook group, which is very exciting. And this is people all around the world that use Jane, clinic owners, staff members, people interested in signing up for Jane. So if you have any questions that maybe I didn't answer or you don't feel comfortable asking and you want to get feedback from a fellow professional, you can join this Facebook group and ask any questions you have. The community is incredible. When we have our rare days that the clinic Jane is closed, when we're on a retreat, we're open Christmas Day. We're not open Christmas Day, but we're open New Year's Day. We're open any of the statutory holidays. So Christmas Day is actually the only day we are officially closed for a stat. But that Facebook community is there to answer any questions anybody has. If you are one of the people that does offer insurance, we also have a US billing community as well. So super helpful there. And then, as I mentioned, booking a demo. So if you are curious about seeing Jane in action and getting more of a personalized tour, you can just use the QR code here to book in for a demo with us, and we'll take you through Jane and show you a little bit more about what it's about, a little bit more in depth than I got into today. But if you're ready to sign up, you can just head to jane.app and sign up, and we'll be with you every step of the way. Any last questions, Tiffany?
Nope, there's currently no open questions. I think it was very interactive and you answered so many great questions. I really appreciate you joining us today for sure.
My pleasure. Thank you so much for taking the time, and thank you everybody that joined and everybody that's watching the recording here. And I
just want to remind everybody that this presentation can be viewed via the link that they will receive by email this week. So all of these, the discount codes, the support email addresses, that type of thing. It'll all be in there. And again, if anyone has any questions, please feel free to reach out to Jane's support or myself, and I can get you connected over.
Wonderful. Thanks for the time today, Tiffany. It was lovely chatting.
Yes, thank you, Lauren. We really appreciate it. I guess this brings us to the end of our discussion. We thank you so much to everybody. Oh, we do have one question that comes in. I don't want Diana to think we didn't get it. It
Let's
says,
do it.
are we feeding AI by doing this?
Great question, Diana. So we don't feed AI, no. So what a lot of companies will do is they'll train these language learning models and feed that information. We do not do that. So we are not feeding AI from that. We're only using AI to generate the prompts. We're not using it to train it on. So we're not giving it any of that private, confidential information. So thank you for that and being able to reiterate that. No, we are not.
Thank you so much, Lauren. I guess this actually does bring us to the end of our discussion, and we thank you to everyone who listened to us today, and we hope you have a great day.
Bye, everyone. Thanks for joining.
Thank you, Lauren.
The information presented in this webinar is for educational purposes only. Please note that holistic nutrition professionals do not diagnose, prevent, treat, cure, prescribe, manage, or heal diseases or medical conditions. They are also not licensed in any state and work with clients, not patients. There are no continuing education credits associated with this webinar.